Hello and welcome to the Parkinson Foundation's program, Mindfulness Mondays. My name is Crista Ellis and I am the Community Program Manager for the Florida and Gulf Coast chapters. I want to personally thank you for joining us today. I'd like to take a moment, if you are not already, and invite you to join us on camera. Take this moment to see your Parkinson's community. You can scroll through the beautiful faces on screen today by clicking through the arrow and simply give them a wave hello. Hi everyone, welcome. It's so good to see you. Welcome. Thank you all for joining us on camera today. During this time of social distancing, we hope that you are able to stay healthy and safe at home. Due to the evolving situation around the COVID-19 outbreak, we are taking every precaution to look after our community. In our efforts to help you stay connected, the Parkinson Foundation is providing weekly educational and wellness programs in a virtual format through our PD Health at Home series. Each Monday at 1 p.m. Eastern Time, we will have a live expert sharing their tips and knowledge during this unique time on how to be mindful. Every week, we will explore a different topic of how the practice of mindfulness can influence your health and well-being. The Parkinson's Foundation is dedicated to engaging and empowering the Parkinson's community. I'm pleased to be able to share this time during our Mindfulness Monday events with you. Mark your calendars and join us next Monday as we dive deeper into the practice of mindfulness and its benefits as we cope with the challenges of physical distancing. To learn more and to register for individual events, visit parkinson.org/PD. This is new for all of us, so we thank you in advance for your patience while we're getting used to doing things a new virtual way. Today's session will be recorded and archived on the Parkinson Foundation website at parkinson.org/PDHealth. Before I introduce today's speaker, I'd like to tell you a little more about the Parkinson's Foundation mission and resources. The Parkinson's Foundation makes life better for people living with Parkinson's disease by improving care and advancing research toward a cure. In everything we do, we build on the energy, experience, and passion of our global Parkinson's community. We provide families with free resources, including our website, parkinson.org, educational books, webinars such as today's event, podcasts, a hospitalization kit, and our toll-free helpline, 1-800-4-PD-INFO, which is bilingual and staffed by Parkinson's specialists. To learn more about our resources and our upcoming virtual events, remember to visit our website at parkinson.org or call our helpline at 1-800-4-PD-INFO. Now it's my pleasure to welcome our guest speakers who will address how cognition, memory, stress, and mindfulness can play a role in your journey with Parkinson's disease. Dr. Amie Hiller is a movement disorders neurologist at the Oregon Health and Sciences University, a Parkinson's Foundation Center of Excellence and VA Portland Healthcare System. Also joining us today, we welcome back Dr. Jeffrey Proulx, an assistant professor of public health and medicine and senior researcher at the Mindfulness Center at Brown University. Dr. Hiller and Dr. Proulx, welcome back and thank you for joining us today.
Good morning, good afternoon. If people can't hear me well, let me know. Great to be with everyone on this Monday morning. And today we're going to talk about mindfulness. Next slide. And specifically how it relates to memory. So I'm going to start out talking some about cognitive changes in Parkinson's disease. And we're also going to talk a little bit about the effects of emotional stress on cognition and possible role of mindfulness to improve cognition, and then round up with a mindfulness practice. And partway through the talk, Dr. Proulx will take over and discuss most of the, I'm going to basically focus on the cognitive changes, and he's gonna kind of do the rest. Next slide. So classically, when Parkinson's was first described, this is the very famous essay that James Parkinson, who the disease is named after, wrote in 1817. He actually thought there wasn't a significant cognitive component. And just for added definitions, cognition is a more global term for how we look at memory and other functions. So it's not just all about memory, and I'll explain this a little bit more. So he didn't really notice that there was significant changes in the intellect. And I'll talk about why he probably missed this with the additional, the initial description of things. Next slide. So when we see cognitive changes in Parkinson's, there's often a progression over time. And almost everyone has some degree of slowness of thought. So just like people with muscles in Parkinson's move slower. There's also slowness of thinking. And as usual in medical speak, we have a fancy word for that called bradyphrenia. So bradykinesia is the slowness of movements. Bradyphrenia is the slowness of thought. So almost everyone has a degree of this, especially if they're not on medications for their Parkinson's early on. And then over time, many people develop some mild cognitive impairment. And this means that things aren't where they used to be, but you can still function quite well. So day-to-day functioning is really quite good. But that if we did formal testing, we'd notice that people weren't quite as sharp maybe as they had been previously. And then dementia is when we see more severe cognitive issues that are affecting functioning. And again, not everyone goes through this trajectory, and we'll talk a little bit more about that, but this is kind of the path it takes if it's going to happen. Next slide. So first I wanted to ask, to poll the audience, did you notice that you had memory or cognitive changes at the time of your Parkinson's diagnosis? Was this something that was evident to you? So a fairly small percentage of people notice this. So only 17% of people noticed that at the time of their diagnosis that they did have some cognitive changes. So that kind of fits, right, with that these aren't real obvious things early on for most people. Next slide. So what do we do about these cognitive changes? Well, whenever you bring up memory or say the word dementia, I think lots of people think, oh my gosh, what's going on? I don't want to lose my memory. I don't want to have trouble with my thinking. And so we're going to say, don't panic, because there's things we can do. And also it's important to know what happens to most people. Next slide. So mild cognitive impairment, this is again where there's the minor changes and things where people can still function pretty well, but they notice things aren't what they used to be. So about 20% of people have this at the time of diagnosis. So that may be in the poll we just did, that those people who noticed something was a little bit off when they were diagnosed. And over time, more than 50% of people will develop this in Parkinson's. So a decent chunk, but that means 50% aren't having it too, right? And then dementia, again, this more severe cognitive issues that we see, 30 to 40% of people, if we were just to take a poll of a group of people with Parkinson's, 30 to 40% of people would fall into a dementia category. And this is much higher the longer people have disease. So 80% of people by the time they get 15 years into the disease. And you may say, wait, if 80% of people develop it, how come only 30 to 40% of people have it? And that's that many people with Parkinson's, develop Parkinson's later in life and don't live 15 years with it. So, and it's a different disease in a lot of ways, depending on the age when it starts. So if I see someone in their 40s who's being diagnosed with Parkinson's, I'm thinking, 15, 20 years from now, there's a good chance they're going to have some memory issues. And these are things we probably need to talk about. If I'm seeing someone in their late 70s, they may not be living with their Parkinson's for that long, just because there may be other natural things that happen over time. And certainly if someone's, in the very elderly range, we don't expect them to live a long time with Parkinson's. But even when you look at age matched, we know that it's 4 to 6 times greater to have dementia in people with Parkinson's than without. So if you had, a 75-year-old with Parkinson's, a 75-year-old without Parkinson's, there'd be a much higher risk, 4 to 6 times higher, in that population with Parkinson's. But again, remember, so this is 30 to 40% of people, but that means 60, 70% aren't in this dementia category. Next slide. So now asking, do you currently feel like you have changes in your cognition and memory? We'll see if we land on the right number here too. So it looks like a much bigger percentage now. And it may also, we might have self-selected, right? That people who are having some cognitive issues might have been the ones more apt to participate today. The other thing that we know is that we're not actually the best reporters of our own cognitive function. So people will say, oh, I have no troubles at all when they have really significant troubles. And then other times, people will be worried about things when it's just kind of normal aging changes that we see and expect to see over time, and not really a significant change. Next slide. So why do we see more dementia, more cognitive changes in Parkinson's? And there's a couple of theories out there. Some of it may be due to age-related changes in the blood vessels. So these are kind of like mini strokes that happen over time. And we know no matter what, our blood vessels age over time, and they just don't transmit the blood quite as well, especially at the very end where the vessels get super tiny. And we see losses of brain tissue there. So that's one of the things. And we call these chronic vascular changes, small vessel disease. There's a few chronic white matter changes, a few names for this. Vascular dementia is something that people might have heard of. So this is likely a contributor in many situations. There can also be Alzheimer's type pathology seen in people with Parkinson's. Alzheimer's is the most common cause of dementia as people get older. And it gets quite common. It's quite prevalent, especially as people get into their 90s. It's very, very common that people will develop Alzheimer's. So if people with Parkinson's live to an elderly age, there's a good chance we might see some of these changes too. So it's probably not just the Parkinson's, but that they have an Alzheimer's component as well. And then in terms of the Parkinson's itself, so we call it the pathological hallmark. It's again, that kind of medical speak. We see these Lewy bodies, which are changes that we see in the cells in the brain. And over time, these tend to start deeper in the brain, kind of behind your, if you were to draw a line to your ears and your eyes, kind of be in the center there, deep. And then over time, they seem to transmit up into more of what we call the cortex, so the kind of parts up here. And that seems to be a sign of when we see more cognitive issues. So over time, that progression up into the cortex, and we see more cognitive issues. So it's probably, in many people, a combination of these. It's not just one thing, but a combination of all three things. But again, it may be a bit individual as to what we're seeing, but people can have 2 or 3 or just one. Next slide. So I wanted to ask this one, because again, I said people aren't always the best designations of how their cognitive changes are. I wanted to ask the care partners, if there's many out there, I don't know how many are on, but do you feel like you've had changes in your cognition and memory? So not nearly as many, but a subset of people with cognitive changes. So we know there's a certain degree of changes that just happen with normal aging. So I think that's important to think of as we think about cognitive changes. Next slide. So when we think about cognitive changes, it's important in Parkinson's to think about what is affected. And we kind of have these domains of cognition, we call them. So attention and working memory. And this is one that's really important today because we're going to talk a lot about how to make attention better. And then language, visual spatial function. So this is how we see things. My husband and I always argue about whose visual spatial function is better. So if it's like me and I'm better at loading the suitcases in the car that they all get in there, that's better visual spatial functioning, I would say. And then memory is remembering specific details of things. And then executive function is kind of this multitasking. I'll talk a little bit more about that. But it's important to think about these things and know what's affected in people so we know how to use the things that aren't as affected to help us do better with the things that are more affected and manage better. Next slide. So here, again, are the domains that I just presented on the other slide. I'm looking at Alzheimer's disease versus Parkinson's dementia. So when we see significant cognitive changes, what categories do we tend to see more affected? So in Alzheimer's, attention is not usually too affected, but in Parkinson's, it can be quite affected. So again, part of the reason this talk is important is to show how we can work on improving attention. Memory is very affected in Alzheimer's, not usually nearly as much as in Parkinson's. So people can work to remember specific details of things and sometimes can be better at that. Executive function, again, which I'm going to talk a little bit more about in a minute, but more affected in Parkinson's dementia. Same with visual spatial, so harder with visual spatial. And language actually is usually very mildly affected in Parkinson's disease dementia compared to Alzheimer's. So again, this may be something that we can utilize, that talking to someone more, using language more, may really help us to get through things, whereas doing something visual spatially, showing pictures, may not work so well. Next slide. So I'm going to focus on the three categories that we see more affected in Parkinson's. So attention and working memory. So decreased attention and concentration are often present. And it's difficult to juggle multiple things at once. So the cartoon here is saying, all that I'm asking is you pay a little more attention to your surroundings. And then he turns with his big beak, what, huh? And knocks the other person off or the other bird off the branch, who it looks like already had a Band-Aid on there. So maybe there is some memory remembering that. But there's things that we can do to work with this. So being careful about having multiple things going on at once. So I'll often tell people, if you're having a conversation with your spouse, turn off the television, turn off the radio, put down your cell phone, really just focus on that one thing that you're doing. Because if you've got 5 things going on, it's going to be really difficult to focus. Next slide. So executive function. So this is multitasking, organization and planning, switching from one thing to another, and trouble with initiating activities. So this is one that we find really early on in Parkinson's. This will often be affected. And I think for a lot of people, if you're older when you're diagnosed, you're not working anymore, this might not be so clear that that it's affected. I think for my patients with Parkinson's who work, this is often a huge issue, and they need to do things like put a sign on their door that says, please do not disturb me from 2 to 3. If they have a task they really have to work on, they need to focus on that, not have those other distractions. And if the phone rings, they go to answer the phone call, it's going to take them a while to be able to shift to paying attention to that phone call and then shift back to the project they were working on. Also, people will, with this decreased initiation of activities, they'll say, oh, he used to love to build birdhouses and to do things around the house and to fix stuff. And now, he makes the list and then it just kind of doesn't move forward from there. So that's something we can see for sure. Next slide. And then visual spatial function. So I talked about this a little bit. This may affect sense of direction. So oftentimes people will have to stop driving because they just have trouble getting around, especially if it's a new area and they've got to look at a map or figure things out, figure out directions. May even get to the point of getting lost in familiar places. So not recognizing the way around the neighborhood or the drive to the grocery store, and a lot of difficulty in navigating unfamiliar places. Misjudging distances and locations. So that example there, there's a cup and it's really on the edge, and it's probably going to tip over any second, and not realizing, oh, well, let me put it back a little further from the edge. So oftentimes visual spatial is a great way to help people understand something if they're having trouble with it, with an explanation. But for people with cognitive changes in Parkinson's, this may not work well at all, and this might not be a good way to go. So just keeping that in mind, or if you try to explain something visually and they just don't get it, that may be what's going on. Next slide. So how do we treat the cognitive issues? Because that's what we're really concerned about, right? If there's a sudden change, that's not typical of Parkinson's cognitive issues. Usually these are gradually progressive things that develop over time. So if all of a sudden I get a call that, Bob is just really confused and he's not the same that he was 2 days ago, and it's just different. Then I wonder about infections are one of the main things, and urinary tract infections are ones that we see a lot. And oftentimes there aren't a lot of symptoms. There may be a little bit increased urination, a little bit of pain, maybe an odor, but these can be pretty subtle. So it's good to check the urine and see if there's an infection, if there's this abrupt change. Pneumonia can be another one. So if there's fevers, cough, we want to think about this. Other infections sometimes too as well, cellulitis, blood infections, things like that. We always want to think about, was there a new medication started? Again, with urinary issues, which are common as people age, a lot of times medications are started for urinary issues that can worsen cognition. Same for a lot of other medications that we use, they can affect cognition. So we always want to check that. And sometimes people just don't really think about that potential side effect beforehand. And then the next thing we want to think about is looking at just the medications that someone's on in general. And again, the urinary medications are one of the big ones. And sometimes I find people go, oh, well, instead of getting up 3 times a night, now I get up twice a night. And I'm more confused on this medication. And I say kind of, well, is that a worthwhile trade-off? And they say, yeah, probably not. So thinking about, are there any of the medications, both for the Parkinson's and the non-Parkinson's medication that we could think about simplifying or getting rid of. And then for the Parkinson's medication specifically, carbidopa, levodopa, or Sinemet is the medication we use the most. And that tends to have fewer cognitive side effects than a lot of the other medications. So over time, we often start out with kind of this cocktail of a bunch of medications to control the motor symptoms. And then we might kind of pull those away over time and just end up with carbidopa, levodopa. Next slide. So non-medication approaches. So one thing we want to be sure is that mood symptoms are not playing a role. It's very common that people with especially depression, sometimes anxiety too, will notice that they have cognitive issues, and it's oftentimes affects memory, focus, attention. So again, things that we can see in Parkinson's cognitive issues, but these can make it worse. And there's even a term called pseudo dementia for people who are really depressed and seem like they have dementia, but when we treat the mood symptoms, the cognitive issues get better. Maintaining a structured, familiar environment can be really important and really helpful. I always tell a story of, there was a study done in a group of nuns who had lived in this convent for many years, had an extremely regimented schedule, did the same exact thing every day, like eating the same meals. And somebody went in and tested people's cognition formally, and a lot of them had horrible cognitive function, but their day-to-day functioning was fine because this was the routine they always did. And so they knew what to do because it was these deeper long-term memories that were there. So that structured, familiar environment can be really helpful. And knowing that when you change that up, when you go on vacation or stay in a hotel room or somewhere different, that might be a harder time for somebody and they might struggle to manage in that. Individualizing a daily schedule, again, so you kind of have that routine. A cognitive rehabilitation therapy can be helpful, and that may do something like might focus on if visual spatial function is really bad, how to use that language function more to benefit things. Also, some techniques such as learning to write things down, using a memory board, things like that. Exercise, I feel like I can't give a lecture on here without mentioning exercise, and I'll talk a little bit about more of that in just a minute. And then mindfulness may be helpful too, and Dr. Proulx will kind of touch more on that. Next slide. So why exercise? Well, it's not just, the Parkinson's that's going on, but we know, as I mentioned earlier, that these changes in the blood vessel in the brain may also have effects. So if we can improve the heart and the lung function, that often helps with these small blood vessels too. And so we can see changes in motor function, attention, cognitive speed when we have better heart and lung function. And exercise does so much. It's not just what it does for one organ, but what it does for the whole body. So we know aerobic exercises improves attention, executive function, and memory in older adults. And then in Alzheimer's, we know that it improves memory, executive function, and balance. So all things that are important in Parkinson's too, right? And then we know it also can help with working memory, processing speed, and visual learning in people with depression. And again, the depression can play a big role. So the fact that we have exercise to help with the depression and can do all these other things, it's just a win-win-win. So exercise is great, can give us so many benefits, including cognitive function benefits. Next slide. So medications come to this lastly. So for cognitive function, we have some specific medications that can help. So if you've kind of gone through your medication regimen and really need what you're on to control the motor symptoms in Parkinson's and still having some struggles, then you might want to think about one of the acetylcholinesterase inhibitors. These are our mainstays. Donepezil, rivastigmine are some of the main ones we use there. And then there's another class called NMDA antagonist, which we don't use quite as much, but Namenda or mebendine is the drug in that class. And then again, we want to make sure we're treating the mood symptoms. And so that could involve some therapy, some talk therapy, but it might also involve using medications. So there's many different antidepressant, anti-anxiety medications that can be helpful here. And I just listed a couple there. And then if there's psychotic symptoms, which I'm not going to go into in detail, but this is paranoias, hallucinations, seeing things that aren't there, hearing things that aren't there, then we might need to think about some of the antipsychotic medications too. And there's two primary ones we use for this, quetiapine and pimavanserin. Next slide. So one more question here. Do you feel your mood affects your memory and cognition? So do people notice a correlation between these two? So you can say not at all, somewhat, definitely, or you're not sure. Your spouse may be better, or your partner may be better at answering this one too. Let's see. So it looks like most people are in that somewhat to definitely category, somewhat not at all. So those may be the people who are staying calm and relaxed most of the time, or may just not have this effect. And then a bunch not quite sure. And I think it can vary from person to person for sure. Next slide. So now we're going to move on to stress and cognition and the relationship to mindfulness. And I'm going to let Dr. Proulx take over and focus on this section. Thanks for your attention.
Great. Thanks, Amie. So good morning, everybody. Good afternoon. And Dr. Hiller had a really nice segue into what I wanted to talk about, because instead of thinking about mindfulness and cognition, I wanted to think more about stress and cognition at first, and thinking about and exploring some of the ways that psychological stress has an effect on our day-to-day cognition, and perhaps an effect on our cognition in the long term. So next slide, please. this is a slide that we've seen before, and one of the things I wanted to point out and get to is that chronic stress and stress in general has these, and I'm not going to get into the details of all these different systems, but you can see that stress has an effect on some of our more critical and more important neurals and neuroendocrine systems in our body. And you can see that, like, for example, hippocampal neurogenesis declines under chronic stress. Hippocampus is where we store our memories. And so you can see that this can have an effect on our cognitive function. And to the right, though, I think you might want to look at the HPA axis hyperactivity. This is one area that I'm going to focus on quite a bit. This is the system that produces cortisol, glucocorticoids, which many of us know as the stress hormone. And anytime that we're increasing our psychological stress, we're actually responding in a way that increases these amounts of these stress hormones in our system. Whether or not we're actually under stress or we're under stressful circumstances, we still respond physically as though we were being attacked by a saber-toothed tiger or a major thunderstorm was coming in. We are physically respond to stresses in that way. So next slide, please. So cognitive function can be affected by psychological stress in the short term. And I go to many different studies that we've looked at in stress. And one thing that we notice is that people have a harder time on days that they're stressed to do simple things like mathematical equations. And so that we find that that's kind of an interesting thing, that you can see that just in the short term, in these areas that you might not even be aware that you're being affected by stress, just the smaller things like being able to do a mathematical equation becomes more difficult when we're stressed out. And in the long term, this goes back to that slide that we just had previously with all the different physiological systems associated with stress. In the long term, if you keep hitting those systems over and over and over, what we start to notice that people who experience chronic stress over time show an accelerated cognitive decline compared to people who report being less stressed at that same age. Now, these are cross-sectional, and we're able to just basically compare people against each other, but it's very common in gerontology for us to perceive stress as an age accelerator. A lot of the same systems that we see affected by aging, the HPA axis or hippocampal size and function, these do deteriorate over time, but they're accelerated by stress. And so this is a reason to be aware of how stressed we are throughout our days. Next slide. And another thing to be aware of is thinking about not just the stress, but how do we perceive a stress? Rob Stowski and some of his colleagues a number of years back found that minor daily stressors basically took attentional resources away in their brain. There's only so many resources we have, and would take the attentional resources away from the processing that we needed to understand day-to-day information that they needed, and it wasn't there for them. And a lot of this was more about how individuals appraise the event to be stressful or not. There's so much around this appraisal. We all experience different events throughout the day, but whether or not we appraise them as being stressful is something that is really critical. So next slide, please. And there are several different studies, and these are just a list of some of the poor outcomes that are associated with psychological stress on cognition, including, as Dr. Hiller was talking about, is increases in negative mood that can have an effect on our cognition, inflammation increases as a result of daily stress, fatigue, which also makes it very difficult to be able to manage cognitive function when we're tired, is also increased under chronic stress. Chronic stress is associated with poor cognitive function and the long-term implications of cognition, and hastens cognitive decline and increases the likelihood of dementia. Next slide, please. And this just kind of goes on and on and on. I think we get the point that stress is something that is going to be, psychological stress is going to be something that has a negative impact on our cognitive function, going into that biological wear and tear. And the negative effects of stress may actually become greater as persons age. And I'll explain that in a little bit more in a second. But there tends to be, though, we're starting to realize we know now a lot about how stress affects cognitive function in later life. What we're hoping to understand more is how does mindfulness affect cognitive function in later life and our overall sense of well-being and who we are. So next slide, please. There's we're looking at now at an image of a systematic review, which is a review of several different studies, 12 studies in this case, done by Gard, Hosel, and Lazar. And what they did is they looked at all these different studies and looked at different aspects of all of these studies and how much did mindfulness have an effect in later life on attention, memory, executive function, processing speed, and general cognition. Now, this is an issue with mindfulness studies in general, is they tend to be smaller. People who come into the mindfulness classes or interventions tend to have a bias already for it. So we have to look at some of these data with a little bit of, not skepticism, but certainly with an eye on making these studies better. But the overall conclusion from these researchers is that mindfulness is not only feasible in older adults, but the preliminary data suggests that it may offset some of the age-related declines in cognition. So next slide. And as the days move forward, we're finding more and more research that's looking at mindfulness in later life. Natalie Shook at West Virginia notes that mindfulness may be an important component to healthy aging. They had looked at studies surveying older and younger adults and comparing to the younger adults. Older adults were much more aware of their remaining years, but they also felt greater positive emotion. So to explain that, it gets into that social-emotional selectivity theory I talked about earlier in this series, is that as we get older, even though we start to sense that life is getting shorter, or the amount of time we have is shorter, that knowledge tends to have older adults then take each moment, living in that moment a lot more attentively than perhaps younger adults. And we believe that that has much to do with the greater positive emotions that older adults tend to report than younger adults. So the way I look at that is that mindfulness is this ability, is this practice, this exercise of being in the present moment without judgment, paying attention to what's happening to us now in this moment. And mindfulness, and as you can see, that takes advantage of our own strengths as we age. We a lot of times naturally make these adaptations as we get older to be able to first of all, adapt to a lot of changes in cognitive and physical functioning. So that way, much like the nuns that Dr. Hiller was talking about, they're able to still function and have a sense of well-being in their life, despite losing some of the advantages of youth and cognitive function. So mindfulness helps us take advantage of these adaptations that we use as we get older to increase that wellness that we have in later life. And also mindfulness may help us make better decisions around, like, let's say, exercise, choosing to exercise or not exercise, or the foods that we eat, and all of our different health behaviors are a matter of choices. And this goes into, I wanted to mention the study very quickly. Ellen Langer had done a study, and this is a little bit different aspect about mindfulness, is that what Ellen Langer thinks about is wherever you put your mind is where your body's going to be. And so what she had done is taken two groups of older men from the Boston area, and she brought them to New Hampshire. And in New Hampshire, they were going to have just a retreat. And so some of the men, half of the men, they just put into a regular vacation. The other half of the men, they recreated the world of 1959, and everybody wore all the same clothes. The TVs that were on, which had TV shows from 1959, they had a bunch of Look magazines and old Life magazines, and everything around it, and the music and the food, everything was 1959, and they spent the week that way. So what the idea is that so much around aging and our cognitive function is about what society tells us it should be. That as we get certain ages, we get letters from AARP, or we get put on Medicare, or certain signals that say that now we're older, and we believe that we have to act a certain way. And some of this is just imprinted upon us and ingrained in us throughout our entire life. We have nothing to combat what the perceptions of aging may be. And what Dr. Langer was suggesting is that because of that, because we internalize what those responses need to be, we start to express those same things. So when she took these men and they were no longer living in the 70s or 80s whenever they did the test, but instead 1959, she noticed the men that were in that group had much better intelligence scores at the end of the study. They all tended to stand straighter. They tended to have better dexterity. They tended to have better gait. And they would have people who saw them before and after pictures. All the people who saw the after pictures of the people that were in the 1959 study all said that they looked younger than they actually were. And so what this goes to is that just be thinking about not only in mindfulness about how you place your attention without that judgment, but not also allowing the signals and the information that the rest of society says that aging should be. You don't have to follow along with that. So next slide, please. To be aware of those signals. And then this question is do you feel like your memory, you need to be able to read that, your memory cognition is better when you're more relaxed? So I'm seeing 60% were definitely, and 29% were somewhat. So that's about most everybody is either somewhat or definitely. Definitely no one not at all. So that's a good one. It'd be interesting to see that. So next slide. So I wanted to do a quick mindfulness practice and take a little bit advantage of what I was talking about with Dr. Langer. And instead of just doing what we would normally think of as meditation of focusing on the breath or on a particular object, I want us to do a visualization practice. And if you would, just close your eyes, allowing your body to be still and sitting with a sense of dignity and a sense of resolve and a sense of being complete in this very moment. And as you sit here, letting an image form in your mind's eye of the most magnificent or beautiful mountain you know of or have seen or can imagine, letting this mountain gradually come into greater focus. And even if it doesn't come as a visual image, allowing the sense of this mountain and feeling its overall shape, its lofty peak or peaks high in the sky, the large base rooted in the bedrock of the earth's crust, its steep or gently sloping sides. And notice how massive this mountain is, how solid, how unmoving, how beautiful, whether from far away or up close. Perhaps your mountain has snow blanketing its top and trees reaching down to the base or rugged granite sides. There may be streams and waterfalls cascading down the slopes. There may be one peak or a series of peaks, or with the meadows and high lakes. Observing your mountain, noting its qualities, and when you feel ready, seeing if you can bring the mountain into your own body sitting here so that your body and the mountain in your mind's eye become one, so that as you sit here, you share in the massiveness and the stillness and the majesty of the mountain. You become the mountain. You're grounded in the sitting posture, your head becomes the lofty peak, supported by the rest of the body and affording a panoramic view. Your shoulders and arms, the sides of the mountain. Your buttocks and legs, the solid base. Rooted to your cushion or your chair, experiencing in your body a sense of uplift from deep within your pelvis and spine. With each breath, as you continue sitting, becoming a little more a breathing mountain, alive and vital, yet unwavering in your inner stillness, completely what you are beyond words and thought, a centered, grounded, unmoving presence. And as you sit here, becoming aware of the fact that the sun travels across the sky, the light and shadows and colors are changing virtually moment by moment in the mountain stillness. And the surface teems with life and activity, streams, melting snow, waterfalls, plants, and wildlife. As the mountain sits, seeing and feeling how night follows day and day follows night, the bright warming sun followed by the cool night sky studded with stars, and the gradual dawning of a new day. And through it all, the mountain just sits. The experiences change in each moment, constantly changing, yet always just being itself. The mountain remains still as the seasons flow into one another, and as the weather changes moment by moment and day by day, calmness abiding all change. In summer, there is no snow on the mountain except perhaps for the very peaks or in the crags shielded from direct sunlight. In the fall, the mountain may wear a coat of brilliant fire colors. In winter, a blanket of snow and ice. In any season, it may find itself enshrouded in clouds or fog or pelted by freezing rain. People may come to the mountain and comment on how beautiful it is or how it's not a good day to see the mountain, that it's too cloudy or rainy or foggy or dark. None of this matters to the mountain, which remains at all times its essential self. Clouds may come and clouds may go. Tourists may like it or not. The mountain's magnificence and beauty are not changed one bit by whether people see it or not, seen or unseen, in sun or clouds, broiling or frigid, day or night. It just sits being itself. At times visited by violent storms, buffeted by snow and rain and winds of unthinkable magnitude, and through it all, the mountain sits. Spring comes. Trees leaf out, flowers bloom in the high meadows and slopes, birds sing in the trees once again. Streams overflow with the waters of melting snow. And through it all, the mountain continues to sit, unmoved by the weather, by what happens on its surface, by the world of appearances, remaining its essential self, through the seasons, the changing weather, the activity ebbing and flowing on its surface. In the same way, as we sit in meditation, we can learn to experience the mountain. We can embody the same central, unwavering stillness and groundedness in the face of everything that changes in our own lives over seconds, over hours, over years. In our lives and in our meditation practice, we experience constantly the changing nature of mind and body and of the outer world. We have our own periods of light and darkness, activity and inactivity, our moments of color and our moments of drabness. It's true that we experience storms of varying intensity and violence in the outer world and in our own minds and bodies, buffeted by high winds, by cold rain. We endure periods of darkness and pain, as well as the moments of joy and uplift. Even our appearance changes constantly, experiencing weather of its own. By becoming the mountain in our meditation practice, we can link up with its strength and stability and adopt them for our own. We can use its energies to support our energy to encounter each moment with mindfulness and equanimity and clarity. It may help us to see that our thoughts and feelings, our preconceptions and our preoccupations, our emotional storms and crises, even the things that happen to us are very much like the weather on the mountain. We tend to take it all personally, but its strongest characteristics of a mountain is that it's impersonal. The weather of our own lives is not to be ignored or denied. It is to be encountered, honored, felt, known for what it is, and held in awareness. And in holding it in this way, we come to know a deeper silence and stillness and wisdom. Mountains have this to teach us, and much more if we can let it in. So in about the minute that remains, continuing to sustain the mountain meditation in your own silence, moment by moment, until you hear the sound of the bells. And I think we have about 9 minutes for some questions.
Thank you, Dr. Proulx. If I could just encourage everyone to take a deep inhale through their nose and let it go. Beautiful. Thank you so much, Dr. Proulx. I'm very relaxed. How are you all feeling? Give me a thumbs up for those of you on screen, or thumbs down. Thumbs up. Great. Wonderful. We do have quite a few questions to get through before we end our event today. So Dr. Hiller and Dr. Proulx, these questions are for both of you to address. How often are cognitive issues due to side effects of PD?
That's a Dr. Hiller question.
Yeah, sorry, I thought I unmuted, but technology. So it's very common that the medications themselves can have side effects, and that cognitive function can be one of those side effects. It's also really individual, and when you review the literature, it's kind of confusing because you'll see some people seem to do better cognitively when they're on the medication. Some people seem to do worse. And that slowness of thinking often responds better to medications. So people will actually be able to think faster when their medications are working and they're feeling well. So we talk about on and off. So you may notice that when you're on, that you do a lot better cognitively. And the medications that we see more cognitive side effects from in general are the medications like the dopamine agonists. So ropinirole, Requip is another name for that one, Mirapex or pramipexole. And then amantadine is another one that can cause a lot of cognitive side effects. So again, we oftentimes will kind of look through the medications and try to simplify what people are on and use more of the carbidopa levodopa over the other medications. And then I also usually try to interact with the individual patient and say, do you notice, that when your medications are working, you're doing better with your memory and thinking, or do you seem more confused at those times? And then try to figure it out. And sometimes we do end up making a balance of saying, okay, we're not going to have you moving quite as quickly as we could, because you seem clearer mentally when you're a little less on with your medication, so at the lower dosages. And so sometimes it becomes a balance between those two.
Thank you. Is there any way to slow cognitive loss? How far will it decline? And is it like Alzheimer's where he won't recognize family one day?
So we think exercise may be the main thing that slows cognitive decline. most of the medications that we use are just treatments. They don't seem to affect the change over time. It's unusual that people get to that stage in Parkinson's disease where they're not recognizing family members. It can certainly happen. And just because you have Parkinson's doesn't mean that there can't be Alzheimer's pathology as well. So people can have both. So I think staying socially engaged, staying physically active is really the key thing there. And again, the memory piece doesn't tend to be as strong in Parkinson's, that loss. So usually people do have where they still recognize people. And there's many people who don't develop, severe dementias with Parkinson's disease. It's, again, if people have it for a long time, it becomes quite common that they'll have a degree of dementia. But for many people, they don't live with Parkinson's that long because of the older age when they would be diagnosed.
Thank you. Dr. Proulx, what are some good ways to learn to focus our meditation more effectively?
I don't know what that means. Focus on meditation. Practice really is the ultimate thing to do, but I don't know if that means just also being able to find meditation resources, for that matter. But ultimately, the best thing to do is to practice and to continue to practice, even on days when you don't feel like you're doing well with the meditation practice. Do it anyways. There's a lot about not having a judgment on how well the practice actually is, and that tends to over time start to aggregate together, and you start to see some changes over time. But it takes the hour, the work, just sitting and doing the 10 minutes, the half hour practice consistently, day after day after day. That's when you start to see the benefits start to come out. And it's practice to be able to place your attention onto a particular object or a breath. It's because I've been doing this now for 20 years or so, and it takes me a very long, I still can't do it. But I give it a shot every day. I come back and I try to just focus on my breath, but my mind goes all over the place. And so the main practice for me is coming back to the breath, right? It isn't just a staying on it. It's recognizing that my mind has been distracted. That's the mindfulness part. It isn't so much that I'm focused on my breathing, is that knowing where my mind is enough to say, oh, I'm not at Fenway Park watching the Red Sox, I'm here breathing, and to really recognize those different things when I get lost in those, and that just takes practice.
Thank you. What are some easy and quick ways for caregivers to de-stress when hallucinations prohibit the person with Parkinson's from moving forward with a task?
I think, yeah, either of us could answer that one. Do you want to?
Go ahead.
Well, I was going to say, one thing is to make sure that the hallucinations are being treated properly, and then if the patient, generally with hallucinations, they're oftentimes, people are very committed to what they're seeing, what they're hearing, and trying to convince them otherwise is not going to be effective. So you might have seen at the very beginning, I had my little kiddos say hello there, quick wave to everybody. And so it's often like my 2.5-year-old, she is convinced that, whales are orange, and it doesn't matter what I say to her, she's not going to believe that a whale's not orange. So rather than going toe to toe with her and going, let me show you a picture, let me convince you, it's better to say, hey, should we go out for a walk and look at that flower in the backyard, and just kind of change the subject to something else. And then in terms of how to relax in the midst of that, I think Dr. Proulx can say more about easy things there.
And one thing I would think about as being an old hospice care provider myself in the past, and is to develop that practice I was talking about, because it's more of doing the meditation practice on a day by day basis sets up a more of a proactive approach. So that way, when you come into high stress situations, you don't react as much as you would have if you didn't have a meditation practice. It's like having a prearranged relaxation period that you just won't respond that way. But then also the same thing goes for the practice, because when you're in that moment and it becomes stressful for the caregiver to be able to respond to what the needs are of the loved one, You've got to be able to have that skill set in that moment. Maybe if you only have 5 minutes that you can get away to be able to do some meditation practice, you can't suddenly learn how to do meditation in that moment. It's practicing it away from, on a nice sunny day when you're feeling good, is practice how to calm your body and how to calm and relax your reflexive responses that you have. Practice, practice, practice.
Yeah, thank you so much, Dr. Hiller, Dr. Proulx, for your time today. I apologize, we are short on time. We won't be able to answer all of the questions. If you do have questions that weren't answered, please don't hesitate to reach out to our helpline at 1-800-4PD-INFO. That's 1-800-4PD-INFO. If everyone who is with us still would join us on camera, we would just like to say, see your face, see each other. And I'd like to give a huge, huge thank you to Dr. Hiller and Dr. Proulx. If we could all give them a virtual round of applause. Yes. Thank you so much for your sincere collaboration and sharing your passion with all of us here on our Mindfulness Mondays event. I sincerely appreciate you both so much. And guiding us through this unprecedented time, bringing our Parkinson's community together through this virtual format so we can see each other. If you are on camera, take a moment to see everyone, scroll through and just say hi with a beautiful smile, nice wave. Yes. Oh, you guys look so great. I want to encourage you all and invite you all to attend our 2020 Care Partner Summit. This is an online event, May 16th. That's this Saturday at 12 p.m. Eastern Time. You can learn more and register at parkinson.org/summit. That's parkinson.org/summit. Thank you all for joining us today. I appreciate you, and I will see you next Mindful Monday. Bye-bye.